Hello everyone, welcome to our channel today. Today we're going to continue to talk about Qi clear, heat clearing formula, especially in Qi level. In Qi level, we're going to discuss only two formula. The first one is Bai Hu Tang. We have discussed in the previous formula. We have discussed in the previous video. And the other one is the one we're going to discuss now, 竹叶石膏汤. So, 竹叶石膏汤, the ingredients of 竹叶石膏汤, as you can see, 竹叶、石膏、半夏、麦冬、人参、甘草、粳米. As you can see from the ingredients, it's actually 白虎汤, 知母 was removed, and we add 竹叶、麦冬、人参. These three to Bai Hu Tang. So it's actually modified Bai Hu Tang. Let's see the main symptoms of 竹叶石膏汤. The patient still have heat symptom. The patient have qi and yin deficiency. The patient may feel hot and sweating, may feel oppressed chest and irritate. The patient may be nausea or even vomiting, thirsty, and red tongue with less coating. So you can see from the symptoms of 竹叶石膏汤, it seems very similar to 白虎汤, but in this formula, the patient may have all symptoms in 白虎汤, but the difference is the symptoms is not as severe as 白虎汤. So the patient may have fever, but not as hot as 白虎汤. The patient may be sweating, but not as severe as 白虎汤. The patient also may feel thirsty, and it's not that bad. So you can see this formula, 竹叶石膏汤, in which condition we're going to use. If the patient got severe hot condition, we use 白虎汤, and when the heat has been clear at some stage. At this stage, when we discussed 白虎汤, we said we could not overuse 白虎汤 because 白虎汤is very cold. If we overuse, we're going to damage the digestive system. So at this stage, what can we use? We can use 竹叶石膏汤. 竹叶石膏汤, it has the function to clear the heat, but it's not that severe. The patient may have qi deficiency and yin deficiency. It is because it's sweating and vomiting. Both of these two symptoms may cause yin deficiency. And also from the tongue, red tongue with less coating. The less coating or no coating, it also indicates spleen yin deficiency. So in this formula, we use 麦冬, which is sweet and cold, 人参, and 竹叶 to clear the heat, to tonify the yin, to tonify the fluid. And we also add 半夏 because the patient is vomiting or nausea. So the dose or the dosage of 半夏 and 麦冬, the ratio, you can adjust according to the patient's symptom. If the patient is nausea, the main symptom is thirsty, we can increase the dose of 麦冬. If the patient is vomiting a lot or severe nausea, we can increase the dose of 半夏. So when you see an actual patient in your clinic, you can adjust the dose. This kind of patient, this kind of symptom is not has to be from 白虎汤 symptoms. If the patient is weak and the body condition is weak, and it causes like qi deficiency or blood deficiency, if the patient suffer from heat attack, if they suffer from heat attack, and it goes to qi level directly, but not very severe. Then we also can use 竹叶石膏汤. There's one rule in the formula in the herbs or in the formula when we treat the patients. If the patient have nausea or vomiting, if the patient have nausea or vomiting, we do not use cold and bitter herbs. Although the bitter can bring down the qi, can help for vomiting, but if the vomiting is because of spleen deficiency or stomach deficiency, we do not use bitter and cold herbs. That's also one of the reasons why we removed 知母 from this formula. 麦冬 was added. 麦冬, the property of 麦冬 is sweet and cold, or sweet and cool. Sweet actually is sweet and cold. So we use sweet herbs to tonify stomach to tonify stomach fluid. In heat clearing formula, we have discussed 白虎汤, 白虎加人参汤 and 竹叶石膏汤. 白虎加人参汤 and 白虎汤. It's only 白虎汤add ginseng. These three formula is very similar. We all use for qi level, but they have different degree, and it is actually from excess hot or excess heat to weakness. So when we use the formula, it's from different steps. If the patient is strong and the patient have excess heat, we use 白虎汤. If the patient is not strong, is slightly weak, and the heat still there, we use 白虎加人参汤. If patient is weak or the heat is not severe, we're going to use 竹叶石膏汤. You also depends on the symptoms, which is dominant. So if in 白虎汤, the dominant symptom is heat. And if the patient, the heat is not as severe, is more focused on thirsty, we use 白虎加人参汤. Or you have the symptom of qi and yin deficiency, especially if the patient have severe yin deficiency, we're going to use 竹叶石膏汤. That's to tonify the yin, to tonify the fluid. So that's how to use these three formula in qi level heat patient. Thank you for watching our video today. For more information, you can visit our website. See you next time.